One of the things that we do every day is to breathe, of course, but sitting in this slumped position, it's difficult to get what we call a full natural breath. When we breathe, this brown structure here is called the diaphragm, and this is all below the heart and the lungs. And the diaphragm moves down and massages all of the internal organs when we breathe properly. So we're getting a good internal massage that helps the movement of our bowels, the digestion of food, health and maintenance of our organs when we breathe properly. But when I ask people to put their hands simply on the chest and on the diaphragm and say, take a breath, what I see mostly is that people are upper respiratory breathing, which only uses this top half of the lungs, whereas really the bottom half is what's doing all the lateral opening and expansion. On this tensegral model, this represents the pelvis of the body and the thorax, that it needs to open like this to ventilate the body and oxygenate it. So the lungs actually open up this way laterally and in 3 dimensions, and the diaphragm allows for this to happen. The diaphragm comes down to what we call the third lumbar vertebra. This is the pelvis, and the third lumbar vertebra is about here. So it actually ties down, it has 2 legs that come down here and tie it, but actually wrap around the aorta. So again, tension in the diaphragm can cause digestive problems because the esophagus food pipe passes through there and can actually strangle this and cause blood pressure problems. And then as the psoas muscles here pulling properly down, that leads to pelvic problems, and all of your organs that were getting massaged naturally in here become distorted. So breathing is a very big part of the regimen of moving naturally, and we teach that as a separate art to fully oxygenate the lungs and take us towards those health benefits. In this drawing we've shown from the front in blue the 2 lungs. And you can see those sort of big conical shaped organs, and they reach way down in the body, right down to the bottom of the 10th rib, which is way down here. And basically they need to open up like this and allow the heart room to beat and breathe. But mostly people only breathe in this upper part. But because it's anchored down, as I explained earlier, by the psoas muscles at the back of the lumbar vertebra here, then when we're in a sitting position, it's difficult to fully expand and breathe properly. So we can, again, spend many days inactively breathing and not working these lungs and getting this body massage. In this picture here, this is showing the upper part of the lungs, breathing only. This is the windpipe coming into the upper part. Then we can breathe deeper, but full breathing incorporates all of the lobes of the lungs on both sides, fully expanding laterally through the rib cage to give this lift to the diaphragm and this digestive propulsion and massage. So we really need to oxygenate our bodies fully with a session each day of deliberate deep breathing. And this is again a modern lifestyle habit that we've lost. These books are copied from a book by Jeff Pike on the power of Qi, who studied ancient concepts again of deep breathing and movement exercise therapy. And most people breathe in this upper respiratory triangle here. And what he demonstrated with his research was even people who exercise are still only using 2/3 of the lungs. It's a very deliberate act to incorporate the full depth of full lung breathing to get this movement of peristalsis and massage. So this is a very deliberate learning, but the oxygen benefits and the health benefits are massive when you learn to breathe properly.